Hi, and welcome back. Today, I will be talking about the symptoms and treatments of vaginal thrush. Vaginal thrush is a common fungal or yeast infection affecting women. This is not classified as a sexually transmitted infection or STI. The common symptoms of vaginal thrush are white creamy discharge that does not usually smell, redness, itching and irritation around the vagina, soreness or pain inside the vagina, and soreness when urinating or during sexual intercourse. There are self-test kits available at pharmacies and these can be used to confirm the infection. Vaginal thrush can be treated with a pessary or cream, a combination of pessary and cream, or an oral tablet. A commonly used treatment is clotrimazole pessary and cream combination that is available at pharmacies without a prescription. This is used only once. Applying Canescool Soothing Cream Gel, Vagisil or Sudocrem can soothe the area and help with itching, burning, irritation and swelling. If clotrimazole pessary and cream do not work, the next step is to try fluconazole 150 mg oral capsule, or fluconazole capsule plus external clotrimazole cream. Vaginal thrush can take 7 to 14 days to clear. There is no need to treat partners if they do not have symptoms. Some women may get recurrent vaginal thrush infections. Getting more than 4 infections in 12 months is usually considered recurrent infection. There are various causes of getting recurrent vaginal thrush and these include using irritants that can change the pH of the vagina, hormonal changes, poor vaginal hygiene, genetic predisposition, stress, tight clothing, or being on antibiotics. The other causes are a rare yeast infection like Candida glabrate, diabetes, immunosuppression or weak immune system. Recurrent vaginal infections may require treatment with an antifungal medication for up to 6 months. Some women may suffer from vaginal thrush after having sexual intercourse. This could be due to several reasons. Semen has an alkaline pH and this can temporarily disrupt the natural acidic environment of the vagina, leading to vaginal thrush. Friction during intercourse can cause microscopic injuries to the vaginal lining and this can facilitate yeast growth and infection. Candida is not considered a sexually transmitted infection, but a partner who has a yeast infection may transfer Candida during intercourse. Some lubricants, spermicides, or latex in condoms can irritate the vaginal lining, increasing susceptibility to thrush. These should be avoided when having sexual intercourse. Wearing tight or non-breathable clothing after intercourse may create a moist environment leading to yeast growth, so these should also be avoided. The usual antifungal thrush treatments can be taken to treat the thrush that occurs after sexual intercourse. If these do not work, oral antifungal medication may be required. Oral or vaginal probiotics may help restore the natural balance of bacteria and these can be beneficial. It is recommended to use fragrance-free soaps and personal care products, and to avoid douching or using scented products in the vaginal area. Water and an emollient such as E45 cream can be used to wash the affected area. It is advisable to urinate after intercourse to flush out potential irritants, and to wear loose, breathable cotton underwear, and to maintain good hygiene without overwashing. The general rule is to see a doctor in person if vaginal thrush occurs for the first time or in those under 16 over 60, if it happens in pregnancy and breastfeeding, if treatment has not worked, or if there is history of weakened immune system. Please note that this is strictly for educational purposes and not intended for a formal diagnosis or treatment.